So let me start my presentation. So once again, I welcome you all, the students, faculty members, participants from the Tamil Nadu, India, and abroad. So I'm very happy that the social work department has taken an initiative to organize a webinar on social work response to COVID-19 mental health perspective exclusively for the social work students. So just before getting into the getting into the seminar, let me try to make a brief presentation about our department functioning and briefly about our university, Bharathidasan University. It is named after the great poet Bharathidasan. It was established in the year 1982, and as of now, we have 37 departments offering 151 programs, including 40 PG programs. As per the centers are concerned, we have 29 specialized centers, and as per the affiliated colleges are concerned, we have 152 colleges comprising of 8 districts. And coming to the department, we are offering three major courses. That is MSW, MPhil, and PhD. And this MSW department was established in the year 1988. And we started our MSW program in the year 1996. And the MSW program, we have three kinds of specialization as we offer in the other schools of social work, namely the community development, human resource management, medical and psychiatry, criminology and correctional social work, and MPhil and PhD as per the university and UGC norms. And apart from that, we have two PG diploma courses on a full-time basis. One is human resource management and counseling guidance. To our credit, I am happy to inform you all that we have completed almost 47 PhDs. And of course, I've been already introduced by Dr. Jerida, and we have a very eminent personalities or eminent faculty members of our department. Of course, I'll be introducing again one by one while they're speaking. And the senior faculty member, Dr. P. Ilango, and Dr. Jerida Nanaje Eljo, and Dr. Nirmala, who will be sharing their sessions tomorrow morning, and Dr. N. Rajavel, who will be sharing his session the day after tomorrow. And the special efforts which the Department of Social Work has taken since the year 2010, the important landmark is that setting up of Child Guidance and Counseling Center, which was established in the year 2010 by Dr. Jerida. And of course, there are a lot of achievements, I would say, regarding this Child Guidance and Counseling Center. And of course, they have completed several counselings. Of course, this is very few, 64, and they have really conducted thousands of awareness generation program, especially related to the school mental health. And they are providing counseling service to the parents and fieldwork training to the students. And as usual, when it comes to the learning, teaching and learning methods, as usual, we have the lectures, individual conference, seminar presentation, project, group discussions, and case studies. And when it comes to the curriculum, we have, as per the UGC norms, we have theory papers, field work and community organization programs, group project, block placement, and dissertation. And adding to one particular thing which I would like to add is that we have a self-study method, wherein a person who have already opted for human resource management can take up another specialization. For example, he can opt for community development or medical and psychiatry on a self-study basis. So this is one of the important area which is we are serving, we are offering this self-study mode since 2005. And we have a very extensive publications, conference, workshop, extension programs. And as of today's date, we have really, I mean, conducted 57 programs. And of course, extension program is runs to thousands of number. And this 314 only during the last 5 years. And total number of publications we have as a department 458 to the credit. And when it comes to the international collaboration, and we recently had an MOU with the Department of Social and Behavioral Studies at University of West Sweden. Even now at present, two of our students are in Sweden and getting undergoing training over there. And also, of course, we are fortunate to have a collaboration with Hovest University, Belgium, since 2017, and we have also collaboration with James Cook University, Australia, since 2018. And one of the another important factor, and we are going to have a center for gerontology. I mean, in collaboration with Heritage Foundation, India, and which has been collaborating with us on having a various orientation program related to old age people since 2018. And these are all some of the funding agencies where we try to get a lot of fundings and for research projects. And one of the highlight recently we had with the Australian team is the GIAN, where global initiative of academic network. So that is one of the important landmark recently we had with the Australian, I mean, James Cook University. And we are proud to say that ours is an UGC SAP DRS1, which is started from the year 2016 and which ends next year, I mean 2021. And very fortunate that our department is being sanctioned with 86 lakhs. And moreover, the trust area which has been identified, and as per our I mean proposal, we have given in the field of social work in mental health. So that's why even right now we are trying to focus more on the mental health field during the COVID-19 situation. And through this UGC SAP DRS1, we are able to have a lot of researchers, extension, seminar activities. And to showcase few, let me show the project done through SAP. So these are some of the studies. For example, perception of school mental health, and of course you can easily go through some of the things. And of course, another 5 projects are in pipeline. So it is under process. So, and village adoption. So since 2000, I mean, 7, we have adopted the village called Manihandam block, and perhaps for the UGC SAP also, our target area is the Manihandam block. And of course, a lot of programs is going on related to mental health, free medical camps, promoting health and hygienic aspects, free tuition centers, and we used to conduct various research surveys in these particular villages. And recently, after myself taking over as a head of the department, we have recently started a forum called Swasti, where Social Work Association for Students. So that is really doing a very wonderful activities, which has been initiatives taken by the student and the research scholars. And these are the some of the fieldwork agencies. So this is just a small number, and but it's a significant NGOs, factories, and I mean, what's the industries where our students go for a fieldwork agencies. And our placements are very huge, and we almost, I'm happy to inform you all that almost 100% being placed. Even recently we had an online test, an online interview being conducted by the various companies for HR, for the medical and psychiatric, even NGOs are coming forward to conduct an online interview. So therefore, I would say that there is a 100% placement for our student. And coming to the area where now today the whole world is suffering and the world is looking is the COVID-19 and coronavirus disease 2019. So of course we are all aware of how the things are going around the world, and now we are on the 48th, as per the India is concerned, we are on the 48th day of lockdown. And when you just look into the statistics, is very alarming, and almost 41 lakhs and 81,146 people all over the world is being infected with with coronavirus. And death, when you just you say the death, it is 2 lakhs 83,868 as of now. And as per the India is concerned, we have 67,200 and two, two I mean six, 67,290, 59. Uh, so when you look into the coronavirus, is actually a family of illness such as common cold, SARS. We call it as SARS, severe acute respiratory syndrome, and others. The COVID-19, of course, is the latest version of this class of illness and is said to have originated in China. So the virus itself is known as severe acute respiratory syndrome, the coronavirus 2, and which is ultimately causes the disease known as coronavirus disease, and that's what we call it as a COVID-19. So on 31st December 2019, the World Health Organization reported the cluster of pneumonia cases in Wuhan city of China. So in January 2020, the World Health Organization declared the outbreak of new coronavirus, the novel COVID-19, to be a public health emergency of international concern. And WHO stated that there is a high risk of COVID-19 spreading to other countries around the world. In March 2020, WHO made the assessment that COVID-19 can be characterized as a pandemic. So almost 250 countries and territories around the world have reported to have COVID-19, and more than 90% of the global COVID-19 cases are currently outside China. So of course we are all aware, but as a social workers we are supposed to know how it is being transmitted through respiratory droplets, and person coughs, sneeze, similar to how the influenza and other respiratory pathogens spread. So thus the majority of the cases have occurred in in people with a close physical contact to the cases. Touching the surface in general, the respiratory virus infection can occur through contact, direct or indirect. Mainly, as I told you, it's a droplet spray in short range transmission, aerosol in long range transmission, the airborne transmission. And what would be the symptoms as of now? The current symptom reported for the patients with COVID have included mild to severe respiratory illness with cough, sore throat, shortness of breath or fever. As asymptomatic is in nature. So mostly what the doctors and most all over the world they say is that almost 80% of the cases are asymptomatic in nature. And what are the things we need to look into? The major things we need to look into is the coronavirus prevention method. So social distancing is one of the important factor. What the many medical professionals says that at least 6 feet distance. So there is should be a safe, I mean, a safe distancing is 6 feet. And of course, whenever we go out, and when we just have an interaction with some other people, and of course, we are supposed to go out for a purchasing of our essential things. Whenever you go outside, where even when you are walking with your family members, we are supposed to wear a mask. And you should cover your cough or sneeze, cover with napkin. Airing the room is very important. Cover by elbow, in case if you don't have napkin, you can cover by elbow. And washing of hands frequently is very essential for the prevention of COVID-19. And of course, we are all used to it, but still we are supposed to, as being a social work students and social work fraternity, we need to give an orientation to many students on how about the washing procedures. And these are the 6 steps where you can able to orient the people on these hand washing techniques. And the best way is, as suggested by many countries, and India, work from home is the best thing, and wear mask and disinfection. So many things we saw, even your car, your door, and your free refrigerators, so desk, everything. You say that there is a possibility of corona infection. Even the surface, when you touch, and people again they touch the same surface, you are likely to get infection. So therefore, disinfection is one of the important area where we need to look into. And stay home. What are the real social work? But social work response, of course, that is the major crush of this webinar. For this COVID-19. And as such, we, the social work students and faculties are present or just in the online. You are now just watching this live. And perhaps I would say that online counseling or telecounseling, that is the one of the important factor now. As a social work, professional social workers, we can try to provide them counseling, because a lot of issues are going around due to the lockdown and COVID-19. So therefore, in our respective areas, I hope that we can think of online counseling. So online counseling in your respective, for example, if you are in Mumbai, you can have a place of where a hub, hub can be had. In Karnataka or Bangalore, you can have a hub, so that you can have a online counseling, the virtual awareness program, because now the order of the day has come to the virtual images or virtual sharing of things. Even this lockout has, the coronavirus has made us to conduct this webinar also, because in the previously we have been conducting the programs one to one, and we send the brochures and everything. Now the things have changing, and of course our social work students should be promoting on the virtual awareness program. Even the COVID-19 can be done through our own way of activities. And changing the lifestyle, that is very important, because normally what the medical professionals say is that bringing your hand to your 3 important area will definitely affect by the coronavirus. One is your nose, your mouth and eyes. These are the 3 sensitive areas. So normally we rub our faces. So many people we have been seeing, many people just taking their hands often to their mouth, often to their nose, often to their eyes by rubbing. But this is a very sensitive as far the corona COVID-19 is concerned. Therefore, as our social workers, we have to promote changing the lifestyle situations, especially in dealing with the hand, dealing with the hands. And important things what we are looking across the globe is the migrant issues. Of course, there is a lot of things. It is a very big area which we need more attention. Of course, we need to look into the lot of things. Let us discuss many things in the upcoming days about all these things, right? and avoid WhatsApp and other social media. Nowadays, the people are more depending on the Facebook and WhatsApp rumors. But look into the government. So look into the as a social workers. No, we are not supposed to believe on the what we get on the WhatsApp or some people they post something or something they unbelievable things. Some doctor, some people talks unprofessional things, and the people they circulate all those things. But as social workers, what I would suggest is that try to look at the Ministry of Family or so, I mean, welfare, website, or go into the WHO website where you will really get the real picture of the COVID-19. So therefore, you are supposed to get into the all such details rather than sticking on or believing on the WhatsApp and other things. Of course, we need to share the real situation that is prevailing across the globe and across the country. And keep engaged in the home. People say the boredom. So after 48 days of lockout, people say they are boredom. So how, as a social workers, we can keep the people engaged? So engagement, even we say in HR, we say that engagement, workers engagement. So similarly, engaging ourselves by reading, by doing some interesting things, doing yoga. So that kind of things has to be inculcated by us. And self-isolation, and that is very important. Suppose you feel that a person is infected or with the coronavirus, you can just better advise them to be self-isolation and quarantine for 14 days. And resilience factor, of course, my own colleague will be dealing with the community resilience and coming to the normality, bringing them to normality is another important area. And further, the digital. So digital India, even the government of India is promoting digital India. So that is the way forward for us to look into the more things. And stigma, reducing stigma is another important aspect as far as social work concerned. Let us not say COVID cases, COVID victims, or COVID disease. They are the people who have COVID, people who have been treated for COVID, or people who are recovering from COVID. So in that way, we can reduce the stigma and minimize watching, as I told you earlier, watching, reading, and listening news about COVID. And suppose you feel very anxious or distrusted, so seek information only from the trusted source and stay home. Thank you very much. I hope that I've made it within the time frame. So now, so please hold. A lot of people are joining.
Yeah, yeah. I'm just setting up my
Yeah.
presentation. Well,
Yes, sir. Just before that, I will just.
yeah, just to yeah.
So now, I'm happy that my own professor, Dr. Ilango, will be presenting on the impact of mental health, social work strategies, and intervention. So he's a very senior professor from from our university, and he has about 32 years of experience uh, in the field of teaching and research. and he was head of the department of social work from August 2008 to 2013, and he was also dean of faculty of arts of our university from 15 to 18. And I'm happy to inform that uh, the that he is a member of a syndicate of our Bharathidasan University, and his area of interest is community development, aging, and mental health. To his credit, he has completed 19 PhDs and 33 MPhils, and yes, a lot of publications with about I would say that about 75 citations, and he has completed three projects. And happy that his distinguished awards and achievement is that best youth Red Cross award in the year 2006, and Sri P.K. Das Memorial Best Faculty and Lifetime Award Achievement in the year 2012 by Nehru Group of Institutions, and he was being appointed as a honorary ambassador for India during the year October 2009, and teacher fellow one of the years of duration extended by University Grant Commissions from 1993 to 94, and he is a fellowship participated for to participate in the international short-term course. I mean, especially on income security for the elderly in developing countries at the International Institute of Aging, United Nations, and he is also fellowship offered by to attend an international graduate diploma courses in gerontology and geriatrics, and he is also a scholar. I mean, visiting scholarship by Cranes Institute, and of course, he has organized more 13 more events, and he has been a very good speaker and a very good motivator for many of the social workers across the globe, and is a very I mean fortunate that we are having Dr. Ilango with us. It is now over to Professor Ilango to make his presentation.
Thank you very much, Dr. Mangaleshwaran, for your kind words of introduction.
Thank you.
Good morning and greetings to everyone who is attending this webinar on COVID-19 response, social work response, with special reference to mental health. Dear friends, I would like to just make it as brief as possible due to the restriction of time. As you all know, mental health is a concept which is relevant for all of us. It's not a topic or it's not a subject which is relevant for one section of the population and not for the other section. This is a subject which is relevant for the entire population, whether it's children or youth or women or old people or people of any educational or socioeconomic strata or any kind of social status. Mental health is a very crucial aspect in our life. Now, if you see the technical uh, technical definition of mental health, as we are all aware, it is just like the WHO definition of health, which states that it's a complete physical, mental, and social well being, and it also includes the spiritual well being, and not merely the absence of disease or infirmity. Whereas WHO has defined mental health very specifically as a state of well being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Now, friends, if you see here, the most important thing is mental health has implications for our physical health, our mental functioning, our social well being, and also our spiritual well being. And it is vice versa, as the famous old sayings goes, sound mind in a sound body. So So, psyche and soma are very closely related. Psyche refers to the mind, and soma refers to the body. So, we talk about psyche and soma being in close connection with each other. Whatever happens to the psyche can have an impact on the soma, that means the body. And whatever happens to the body, like for example, some say or any bear this in mind while talking about mental health. Um, in general, when you talk about the characteristics of mental health, what is it that makes a person mentally healthy? A mentally healthy person will feel good about himself or herself. A healthy person or healthy people will not be overwhelmed by emotions such as fear, anger, love, jealousy, guilt, or anxiety. Or, in other words, they will not be overwhelmed by negative emotions. And having lasting and satisfying relationship is one of the important characteristics of mental health. People who have a sound or healthy mental, healthy state of mental well-being will have lasting and satisfying relationships. They will not have superficial and fleeting relationships. So, ability to remain in long-lasting relationship is a characteristic of mental health, and feeling comfortable with other people, not feeling that you are inferior or superior, or you will not have compatibility problem with others if you have a sound mental health. And the last thing, though it's it's a bit probably we may take this very lightly, but it's very important for a person to be mentally healthy. He needs to be able to laugh at himself and also with others. So that means you should have a sense of humor. You should be able to enjoy the fun. You should be able to take everything, in the right spirit. And even the negative things, we need to understand what is really happening. We need not be overwhelmed, and we have to be very positive. We have to stay positive, and we have to have a very proactive, mental state, where we think of what we can do to prevent hardships rather than reacting to problems and then trying to clear the mess which we have created for ourselves. So that is very important. So ultimately, mental health is so important because it affects our thinking, our feeling, and acting. It also helps us to determine how we handle stress. A person's mental health definitely affects his ability to handle stress and the person's ability to relate to others and to make proper choices in life. So these are some of the general aspects of mental health. And now, if you see the global scenario on mental health, at this point, I must tell you, my dear friends, that this is a pandemic which has, come up recently, and I think we are, experiencing it right from December or January, and we are also experiencing this lockdown for, I think, as Professor Mangleshwaran mentioned, 48 days or so. So this is a recent crisis. This is a fairly recent pandemic, and we have had epidemics earlier, and we have had cholera. We have had uh, plague, and all kinds of such epidemics. But we have not had such a huge, pandemic situation, except for a rare, maybe for a few rare occasions. Now, what we are grappling with is a major pandemic. Pandemic means a disaster, a health-related crisis, an infection which spreads rapidly throughout the world, which covers the entire world. So now, in this context, because I said it's a recently emerged crisis, we still do not have much of scientific research on the mental health impact of COVID-19. So please, my dear colleagues and friends, keep it in mind that we do not have that much authentic data on the mental health implications of COVID-19 in different parts of the world. But we still hear a lot of things in the media. We still hear about people committing suicide. We hear about people feeling depressed. We hear about people who are feeling frustrated. We hear about frontline workers like doctors, nurses, social workers, and other professionals feeling, burnt out or feeling exhausted, and they are not able to go about with their routine. They have anxiety, stress, and depression, and all kinds of things. But please remember, only after this COVID-19 pandemic ends, and let's hope that it ends soon. And when we have the resumption of normal life, people will start looking at the impact of mental health, impact of COVID-19 on mental health more systematically and scientifically. And I'm sure a large number of studies around the world will emerge in the days to come. And we also have to do our part. I request you all, my dear social work members of social work fraternity, whether you are a student or a research scholar or a faculty of any stage, whether you are young, early career or mid career or a senior professor like me, I appeal to you to take up research projects on what really happens during this lockdown, how people's mental health gets affected. Please do consider doing your master of social work research dissertations. Of course, not all can do that.
கட்டாதா?
But I would encourage many of you to impact and also take COVID-19. I watched an interview by a person in UK who came out of the hospital. He's a well-built man, young man, very handsome man, and he was crying. He was literally shedding tears in front of the camera person, and he was telling the kind of ordeal he went through. Was so bad, so horrible. So he felt extremely depressed. So these are lot of things are happening. So I would encourage social work researchers to take a close look at the mental health of people post COVID-19 scenario. So just quickly a few points. More than 450 million people suffer from mental disorders in general all over the world. And according to WHO, in India, before I talk about WHO, in India, more than 10% people are suffering from some form of mental health issues, either minor or major, which constitutes about 150 million population. Right now, if you take our population as 138, 1.38 billion, then we are dealing with a population of 138 million people with mental health issues. And among that, about 2 to 3% of the people are suffering from major illnesses like depression, schizophrenia, manic depressive psychosis, obsessive compulsive neurosis, and many other disorders, personality disorders, and things like that. So according to WHO, already we are in 2020. WHO had predicted this, that time itself, in 1996 itself, as reported by Murray and Lopez, that depression will constitute the second largest disease burden worldwide. And that is the state of affairs now. Now, depression is the second largest disease burden worldwide. It affects a lot of people around the world. And a lot of people have masked depression. Their depression is not known to others. They have depressive features, but they may not have serious depressive, symptoms. They may not be suicidal. They may be able to manage their depression, but still they struggle with it. So it's called minor depression, or what you call as neurotic depression. And then global burden of mental health will be beyond the treatment capacities of developed and developing countries. There is one equalizing factor between developed and developing countries, that is burden of mental health care. There is no other equalizing factor, my dear friends. Developed and developing countries will always have various dividing lines. But when it comes to global burden of mental health care, we will all be the same. Now we are seeing that in COVID-19 situation, isn't it? In COVID-19, what is happening? America, USA, Germany, Australia, Canada, Japan or China and India, all of us are facing similar problems. In fact, the developed countries seem to be having greater burden. They are suffering more because of the enormous, huge mortality rate. So I will not go into further details for want of time. The social and economic costs associated with growing burden of mentally ill focuses the possibilities for promoting mental health as well as preventing and treating mental health. So in this corona situation, social workers, we have to have both preventive approach and also a kind of remedial approach in dealing with mental health issues among people. So I'll come to that a little later. Now, in Indian scenario, just to sum up the Indian scenario, 1 in 5 Indians will suffer from depression in their lifetime. So it is estimated that in the near future, about 150 million people across India, as I mentioned earlier, will be in need of mental health care interventions, both short and long-term care. And 42% of private sector employees have general anxiety disorder or depression. This is a known, authentic, fact. 42% of private sector employees suffer from generalized anxiety disorder or depression, and that means almost half. In fact, a huge proportion of employees, and 46% of the private sector employees report, extreme stress as a result of their work. We all know the high levels of stress which all sectors, all employees of different sectors experience in the recent past. And the suicide rate in India is higher than the regional average. That means South Asian region or Asian region, and even the global average of 10.6. This is of course the data of 2015, but our suicide rate in India is higher than the regional average of 10.6. This is of course the data of 2015, but our suicide rate in India world. And I need not focus on this much. Student suicides, youth, the suicide rate among youth keeps increasing almost literally every day. And now coming specifically to the disasters and their impact on mental health, I'm not going into all the details because we have Professor Ramanaya, one of the doyens of social work education in the country and an expert in mental health, who would be giving his valuable thoughts after I complete my presentation. But still, since I have made a preparation to talk to you about the impact of mental health, kindly bear with me for another 5 minutes or maybe maximum 10 minutes to complete my talk, after which our mentor, teacher of teachers, Professor TBBS Ramanaya, will share his views. So when you see disasters, I need not tell you again and again, disasters cause a lot of stress, anxiety, trauma, and other psychological symptoms. And the psychological effects have a massive impact on the concerned individual and also on the communities. And every year, individuals and communities are being affected by disasters, which disrupt their mental health and well-being, which I need not stress much. We all know that disasters have become a regular, occurrence now. When we were young, when I was a school boy, when I was a college student, we never experienced any major disaster. I can't remember any major disaster. But now we come across so many disasters happening in different parts of the world and affecting the lives of hundreds of thousands of people. And to give you a general idea of the the Corona 19 as a disaster, Now, why do we consider this as a disaster? Because if you see the taxonomy of disasters, the classification of disasters, you see meteorological disasters are there, geological disasters are there, environmental or biological disasters are there, and then you have the man-made disasters which are caused by technological aspect or industrial aspect, like oil spill or gas leak. Even recently we had a gas leak in Visakhapatnam. All those things are there, and warfare, a man-made disaster due to warfare. But if you see this slide, this global epidemic or pandemic comes under the category of environmental or biological disaster. Could everyone kindly mute your mic because I am getting some disturbance?
ನೋಡ್ಲಿ ಸತೀಶ್
Yeah, kindly
ನೀವು
mute your mics.
ಪ್ರಸ್ತಾಪಿದ್ದೇವು
So
ನಾವು
this
ಮೂರ್
is a
ಸಾವಿರ
biological disaster. COVID-19 is called as a biological disaster,
ಇದು ಮುನ್ನೂರ ಎಲ್ಲ ಮುಗಿದು ನಾವು ನಿಧಿ
which is defined as I think some participants have kept their mic unmuted, so I'm getting a lot of noise. Could you kindly turn off your mute the mic? Yeah. So the COVID-19 is a biological disaster because it's defined as devastating. Its devastating effects can be caused by an enormous spread of a certain kind of living organism that may spread a disease, a virus, or infestation of plant, animal, or insect life on a pandemic or on an epidemic or pandemic level. This is a definition of biological disaster. It's caused by epidemics or accidental release of virulent microorganisms. We know that there are a lot of controversies going around about whether this is a man-made disaster, like whether it's because of the accidental or intentional release of viruses by people with some idea, and then, the bio warfare, bioterrorism, and all that. I don't want to expand further on that. Now, coming specifically to this COVID-19, I'm not going into the details of the COVID-19 pandemic as such, because Professor Mangleshwaran has done a remarkable job of covering all the details of this disease and its various ramifications, symptoms, and how to stay safe, how to guard ourselves and our families and our society. I think he has given a beautiful overview of that. So I would not go into that, but I just want to highlight that India, there is a concept called this notified disaster. So now this coronavirus disease has been considered as a notified disaster by our country officially, as per the Ministry of Home Affairs, declaration. And it's also interesting to note. I mean, of course, it's also disheartening or saddening to note that we are actually situated in the territory, in a geographic area in the world which is called as World Hazard Belt. Of course, this is not with reference to COVID-19, because we get a lot of floods, lot of tornadoes or hurricane, things like that, or cyclones and all that. So, but this corona has been considered as a notified disaster, and subsequently the Disaster Management Act of 2005 has been invoked for the first time in India. Now we experience all the hardships related to that. Of course, it is essential. Government has to impose a lot of restrictions. Government has to impose a lot of definitely we have to protect ourselves. Definitely we have to restrict the movement of people in large gatherings and all that. All these government measures are extremely important. We have to abide by them because it's a pandemic. Now, with reference to the impact of mental health, impact on mental health, of course, again, WHO has also considered, this is just a slide showing the WHO's declaration about coronavirus. I don't want to go into the details for want of time. Let me get into the specific impact on the, this is just a slide showing the WHO declaration about coronavirus. I don't want to go into the details for want of time.
Hello.
You can go through these things and get enlightened. For want of time, let me just go to the last part of my presentation. I had planned to talk about these things in a little more detail, but I think we are really running short of time, and we need to give sufficient time for Professor Ramanaya. So I will just highlight that the World Federation for Mental Health has appealed to all countries and their governments to ensure that national mental health plans are designed to manage the mental health consequences of the global coronavirus health emergency. So this is, you must remember that this appeal has been made to all countries and all the government. That means none of the countries have a proper system in place to take care of the mental health aspects of such a huge emergency, health emergency or a pandemic. So mental health is a precious commodity and a national asset. You know, when mental health is affected, you can imagine what will be the impact on the other aspects of our individual, personal, and familial and community life. And many countries are currently experiencing
Hello.
unprecedented impact of the COVID-19, and the situation has become a very dire situation. uh, and impact on children. Children seem to be suffering a lot because they are homebound. Their schooling is affected, and they are not able to involve themselves in active learning process. They are also likely or prone to spend more time in front of gadgets or with gadgets, and they are also prone to develop a lot of anxiety and stress, and also boredom. And some children may be creative. They may be very very much involved in doing some productive things. I see, so there was a boy who made an online appeal to people and collected a lot of money, and collected a lot of essential food items and distributed to the people who are on the street. Now, not all children are doing that. So you must understand that most of the children are confined to their houses, and it can cause a lot of stress and a lot of difficulties in their learning and in their development, psychosocial, and overall psychological and personality development, because this is a huge crisis which they are facing now, and the impact on elderly is very severe. I need not go into the details, but most of them are vulnerable. They are not able to get the essential help. They are not able to get essential medicines, and they are suffering from neglect, and even exposed to additional suffering because of shortage of mental health services. Recently, the registrar of NIMHANS, which is the National Institute of Prominence, Dr. Shekhar, Professor Shekhar, was sharing with me that about 68% of their patients have been discharged, because the government wants NIMHANS to function as a COVID care center if the need arises. So you can imagine 68% of the patients have been sent out. Now, does it mean that they don't need treatment? They all need treatment. They all need treatment, but those who need hospital-based treatment or inpatient treatment are deprived of that treatment. And also patients who are availing of outpatient care, and even homes which are running mental health institutions, mental health care facilities, they are all affected. So, and on the whole, it affects families. I don't want to go point by point. I just summarize. And impact on people with mental illness is tremendous. People with mental illness, those who are in families, they are somewhat protected. But those who are wandering mentally ill, those who are kept in homes for the mentally ill or mental health care homes, not all care homes are of high standard or professional level. We have institutions which are also not very professional, and we have some religious centers where mental psychiatric patients are, persons with psychiatric illnesses are kept and given some traditional healing and all that. But now, because of this lockdown, all that is not there. So the whole caregiving system for mental illness has undergone a tremendous impact. And there is a huge impact on socially disadvantaged and migrant populations. I need not overstate this, overemphasize this. The migrant laborers are worst affected during this time of crisis. And this is an important aspect we must not forget. It also affects the mental health of our caregiving professionals, which includes social workers. In India, we don't have a visibility still, but we all need to come together and fight for the recognition. We have to, fight in a democratic manner. That means we have to organize ourselves. We have to have a national body, and we have to lobby. We have to rally around. We have to really work for the establishment of a national council on social work education, and then only the professional status will be granted to social work. And otherwise, there's no point in blaming the government. So the caregiving functionaries, medical doctors, nurses, social workers, counselors, and all these people, even the sanitary workers, they all have anxiety, depression, insomnia, high levels of stress, and all that. So I will stop there. I think I will keep these things for future, session if there is any possibility. But I would appeal to you to look after your mental health. All of us need to maintain our mental health. Important thing is have a routine. What happens during lockdown is we are not following routine. Because of the lockdown, we sleep longer. We get up at any time. We talk. We eat. At the proper, we don't eat at the proper time, but that's mental health one have a problem. So we have to maintain a routine at home, get up and go to bed at a similar time every day, keep up with your personal hygiene. Just because of lockdown, you need not be shabby, or just, of course, you may be thinking, oh, this person is having beard and he's saying that is because of my illness, it's because of my health condition, debilitating health condition. Otherwise I would not be like this. I will be different. So eat healthy meals at regular time, exercise regularly even within the house or in your neighborhood, allocate time for working and time for resting, make time for doing things you enjoy, minimize news feeds. That's very important, because news feeds, as Dr. Mangleshwaran said, don't allow the social media to crowd your mind, because crowding of mind with thoughts, with all misinformation, wrong information, unhealthy information, negative information, will only spoil your mental health, and it will spoil your functioning. And quit other habits like tobacco or drinking. I need not say that. Then avoid, reduce screen time. Of course, this is a time when we are likely to spend more time on the screen, on gadgets. But try to have a control over it, and avoid video games, or minimize that. Help others if possible in your neighborhood. Support health workers, and above all, don't discriminate anyone who is affected by COVID-19. Whether a person, even if a person has died, and don't discriminate that person's family. So we all have to have a very positive approach to this, and we have to prepare ourselves for the post COVID-19 situation, about which we are thinking of having some events in the near future. So we'll keep you informed about it. I thank you all for your patient hearing, and I would like to take up if there are any questions towards the end of this session. After I complete, I think Professor Ramanaya will speak. Thank you so much for your patient listening.
Thank you, sir.
Thank you,
Thank you,
Mangal.
sir. Thank you. Really, thank you. That was a really wonderful
Thank you, Mangal.
sharing on mental health. And this shows your the experience you had for the past 32
Thank you
years
so
in
much.
the
Thank
field
you
of
so much, Mangal.
mental health.
Thank you so
So
much.
thank you, sir. Thank
Thank
you.
you, Mangal.
Now we have Professor Ramanaya with us. Uh, can you able to see Dr. Professor Ramanaya? Is a retired professor of social work from University of Mysore. He is a postgraduate in social work from Andhra University, and is having a postgraduate diploma in psychiatric social work from National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore. And he received his PhD in social work from Karnataka University, Dharwad, and PhD in sociology from Shivaji University. So he has received two doctorate degree. So that's a really a
Yeah.
wonderful thing. And he is serving as a visiting professor for different universities across India and a member of selection committees on several occasions. So I am also indeed happy to say that he is also one of the a selection committee member of my own selection in the
Yeah,
Bharathidasan
yeah.
University. So that's a wonderful thing. So I'm happy that with more than 3 decades of his rich experience, he has extensively published multidisciplinary articles in national and international journals. In addition to the academic experience, he was involved in major research projects which were sponsored by ICMR, World Bank, Karnataka Forest Department. Recently, he was awarded Emeritus Fellowship in the subject social work by the UGC. He is currently serving as a non-official member of Karnataka State Mental Health Authorities and as a honorary professor at Karnataka State Rural Development and Panchayat Raj University Guard. So thank you, sir, for joining us. Now it is over to Dr. Ramanaya sir for his presentation. Thank you, sir.
Ramanesh sir, are you
Ramanaya sir.
online?
Hello. Ramanaya sir.
Shall I give him a call, Mangal? He was online. I think there
Okay.
was some problem. I think probably some network problem or something. I'll
Okay.
just
Okay.
call him up. I'll just
Okay, sir. Okay, sir.
Priti, Pritma, Ramane sir திரும்ப phone போட்டு.
So in between the hello,
Yeah, sir.
there was
Welcome,
a
sir. I think Ramane sir has come in.
yes, sir.
I heard his voice. Ramane sir, are you online?
Hello.
Hello.
I think he left, sir.
No,
Or
no. He's
there.
waiting for our session only.
Okay.
Um, yeah, but I think he has some problem with his laptop or something.
Okay.
Just I'll give him a call.
Okay.
Priti, call பண்ணுமா? Ah, urgent, urgent. Hello. So in case his connection had gone, should he be readmitted, Mangal?
Because actually
Do we have
12:05
to
we are
admit him
supposed to
again?
close, sir. That is what
I
as
know.
per
Yeah,
plan.
yeah.
Maybe
Is
if,
it possible to?
because almost 123 people are waiting online. Maybe just we will wait for 1 minute. Is it okay? Mm, just
Yeah, yeah.
is coming, sir.
Hello, sir. They're waiting, sir. Hello. There's some network problem. Just one call button. Sir, please come online. He was online throughout.
Okay.
இல்லை சொல்லுமா சார் வெயிட் பண்ணிட்டு
Professor Ramanaya's microphone is turned off.
Ramanesh sir, please turn your microphone on. Sir, you have to unmute your mic. Unmute. Sir is speaking itself, it seems, Mangal.
Okay, sir.
Yeah, but is he visible on the
No,
screen?
no, sir. Not yet. He has not made his.
Oh, no, he will.
It's not there. So
In the meantime, if there are any questions, we can take up, Mangal.
yes, sir.
One
There
or two
is,
questions.
yeah, one question, sir, because which I received. Um, Let me, because I told that what would you suggest to rural people and
Ah,
uneducated people, mm, people about awareness. They have neither aware about online counseling or washing hands frequently. As social worker in this pandemic will not be able to give awareness. What would you suggest an alternative way of giving awareness? So
yeah,
this, I think this was the question to me, because I was suggesting
yeah,
online counseling, because even I also in between I also just referred about the telephonic counseling also. So it
yes,
is not necessary that online means through WhatsApp. Maybe some old people may not be having WhatsApp,
yeah,
but I hope that we can have a telephonic, because I said we have a tele counseling is also possible. Therefore, we can suppose they want to talk to as a social worker, they want to get to know about these details. I hope that through telephonic conversations also we can able to just emphasize about the importance of hand washing, or about the corona COVID-19 to them. I hope that that can be also done. Is it, sir? So if you
yeah.
want to add
So,
something
just to
more,
add, yeah,
yes,
yeah, no,
sir.
you
Yes, sir.
said it very correctly.
Yes, sir.
Just to add a few more things, I
Yes, sir.
think as the person who asked the question, I think he or she wants to know how our rural people who are probably very much poverty stricken and not much educated, or maybe the illiterate segments of the population. I think there is a technology divide which is really a problem.
Yeah,
So we cannot, as you rightly mentioned, we cannot think of using online counseling for them. But
yeah,
now that the situation has been eased to some extent,
yeah,
and the curfew has been relaxed to some
yeah,
extent with restricted movement. The problem
yeah.
is social workers. We are not officially recognized as frontline workers. If
Yes,
we
yes.
work towards that, first of all, if we work for the establishment of our identity as caregiving professionals in the community, then
Yeah,
even during a crisis situation, with precautionary measures, as they say,
yeah,
with PPE,
yeah,
personal
yeah.
protective
PPE.
equipment, yeah,
Yeah,
like mask and all that, you can we have to go around and serve the people. Of course, we
yeah,
cannot say we will not go out and we'll try to safeguard our lives and all that, because see, doctors are losing their lives, nurses
yeah,
are losing their lives, and other frontline
yeah. Of
care
course.
workers are losing their lives. So why not? I'm not saying social workers also should lose their lives, but what I'm saying is
Yeah,
this
yeah,
risk is there for all of us, for everyone. So, but our profession is not recognized in the country, unfortunately. And unless we do that, it is
yeah,
very
yeah,
difficult. But in the meantime, all of us can do whatever little bit we can in our own neighborhood. Just visit your neighbors.
yeah,
Check the village people. Just if you are in a village, check your neighbors. See people who have any problem, and try to help them through a direct one-to-one situation with the precautions like mask and maintaining social distance or physical distance. That's a
And
point I
there
just
was
wanted to.
another question, sir, a very
Yes,
interesting
Mangal.
question.
Ah,
Why the government failed to delegate the roles to social worker like us? So that's
that's right.
really
Yeah.
wonderful questions. Yeah,
Yeah. And yeah, that's a point I was also addressing when I said the lack of recognition.
yeah.
All of us as
That's a very
social work,
important thing. Yeah.
yeah, social
Mm.
work faculty and social work students all over the country, we felt very sad to see the notification from UGC, sometime back. I think once or twice it came that social work is not a professional course. But we cannot blame government or UGC. They are right in what they are doing, because if you go through the guidelines of UGC, social work is not a professional course. It is a interlevel council, and regulatory mechanisms for a professional course, it can be considered as a professional course. That is the
Of
reason
course,
our
that's right, sir.
social work profession is not considered as a profession.
True, sir.
I think here the youngsters, the young, social work, budding social workers, they have a greater role to play because they are the vast majority. I think all of us have to come together and work together for getting ourselves recognized, and we have to work at all the three levels: micro, meso, and macro level. We have to lobby with officials, make them understand what we are doing, and get the due recognition. Mangal, would you
Yes,
like to
yes,
add
sir. Yes,
something?
sir. That's really fine. So, as you said, licensing is one of the important
Yeah,
issues. We need to just lobbying with the government about things, and of course, the social workers should be recognized as counselors, because when you say the word counselor means everyone claim that I am a counselor. Even the sociologist
yeah,
claim that I'm a counselor. So, therefore, we need to be more specific about the getting licensed. So in that way, I hope that we can able to do better service to the society in terms of social work fraternity. And many people have asked why people don't have awareness about counseling or casework. It is not necessary that the counseling and casework should be known to the people. Even I would say that even doctors know. Suppose they are prescribing medicine, we do not know what is
yeah,
the medicine we are taking, but they
yes,
take and we believe on the doctors. Similarly, that was a question from one of the participants that people do not know awareness about counseling or casework. Of course, we should, as in many books, no. So, what is the thing is that we have to emphasize that what really we are doing with the clients. So that is very important, because we have to show an impact on people. Because as doctors shows that suppose we take a tablet,
indicate.
one or two tablets, and it gets rectified in 2 or 3 days. And similarly, so as a counselor and as casework, no, we are supposed to emphasize on how the counseling is effective towards the rural mass, and so that the changes has to be seen visibly. That is very
Yes.
important. The
Yeah.
changes has to be seen visibly from the people, and after a week or so, and they should come out with an answer that, sir, I came for a counseling to you, and you did a counseling to me, and of course it was a really wonderful things that has brought changes in my life. So that way the clients should try to recognize our social work. It is not our
Absolutely.
social workers ourselves recognizing our own self. So the question is that first we should recognize our own self, and furthermore we should get recognition from the people about the counseling and casework practices.
Absolutely, Mangal.
Yes,
Yeah.
sir. Yes, sir. So, thank you very much, all of you, because we'll take up the questions because we are running short of time already. We are beyond schedule, and we are now 12:20 of Indian Standard Time. So, thank you very much for each one of us for joining us for this webinar on the first day, and meet you all tomorrow. Thank you very much. So, thank you all. We meet tomorrow at 11 o'clock sharply. So be one instruction which I would like to say: mute your audio, because lot of people are just disturbing us while presenting. So kindly, and also your video should be turned off. So I hope that you had a wonderful, have a happy days, and have a fruitful. I think you had a fruitful learning on this first day.
Mm.
So have a safe
Oh,
day.
good.
Thank you very much. So thank you, one and all. Thank you,
Thank you very much, Mangal. Thank you very
thank
much,
you, sir. Thank you,
Jerida and others. Thanks so much.
thank you, one
Thank
and
you
all.
very much,
Yes, thank you
participants.
so much, sir. It was a
Thank
wonderful
you.
Thank you, thank you.
session. It was a wonderful
Thank